I'm Dr. Yuvraj, and of course, you know Dr. Pooja. Today, we are going to do something interesting. So, we have most commonly asked questions on Quora regarding infertility. So, we are seeing them and we'll be trying to answer some of the questions that actually people are asking on Google. So, the first question, Pooja, is it's a little tricky. What does it feel like to be infertile? You treat thousands of patients of infertility. So,
I think it's devastating if somebody is trying to get pregnant and they're not getting pregnant. We have patients in tears every time their period comes. So it's not a good feeling at all.
what are the most common causes of infertility?
Common causes of infertility, I think nowadays is unexplained infertility, male factor, tubal factor, ovarian issues like PCOS and ovarian failure, and sometimes endometrial issues, fibroids, endometriosis and stuff like that.
Remember, men, even you can be infertile. That is the most common problem we face. People think men are invincible, but 50% of them have male factors. Is infertility a common problem?
I think it's very common because it's increased from 10 to 15% to almost 20% in the last 10 to 15 years of my practice at least.
It is now becoming a common problem, definitely, and there's nothing to be. We have treatment. That's what we are here for. So if you feel you're
Because nobody wants to get married. 10 years back, people wanted to get married at 20. Now they don't even want to get married at 35.
okay, I'm not answering that. Have you overcome infertility without a doctor's help? Someone is asking people that, do you think you can overcome infertility without a doctor's help?
I guess so. In unexplained infertility, miracles do happen, and we have had cases where suddenly somebody got pregnant after 10 years.
Especially in COVID.
Yes.
So we saw a lot of patients in COVID because they were not going out of the house. I think the interpersonal relations were improving, sexual frequency was improving. A lot of people got pregnant naturally who were actually planned for an IVF. So you can, but of course, the thing is, a doctor needs to tell you. So it's not that you come to a doctor and we always put you for IVF. Sometimes we just tell the patient, try for 6 more months, ye cheezon ka dhyan rakho, and they get pregnant. This is interesting. Why did my wife hide the fact that she's infertile? Why do you think people hide it?
I think so.
Yeah.
Because I think IVF and infertility is still a taboo. In our society, a woman is not complete unless she becomes a mother, which is entirely not true. There are a lot of women who do not want to get married, who do not want motherhood, and they are still women, and I think they are complete in themselves.
But I want to ask this, I'm sure it's a guy, and I want to ask him, usko छुपाने की ज़रूरत क्यों पड़ी भाई? Maybe she didn't trust you or she was scared of you, so more than her, you have to work on yourself, right? मतलब why should she hide? उसको ज़रूरत ही क्यों पड़ी? This is also an interesting question. So I think we've seen this happen a lot of time. Has anyone had their spouse leave them because of infertility?
Yes.
Yeah.
Like, especially not now, but previously we've had spouses leave their wives thinking that they are infertile and the problem lies in them. And even if they get married again, they're not going to have a baby.
Yeah. So I think unfortunately, this is the truth of a society. We've seen, in fact, we also have patients who come hiding from their spouses just to know that, how can I know she's fertile or infertile? In-laws coming in asking, क्या इसमें problem है? क्या ये शादी से पहले पता था, नहीं पता था? Which is sad.
And I even know of a couple who married, the husband married again and both the wives are living with him.
So, yeah. A scientific question. What are some examples of infertility symptoms? So what should people look for?
So I think if you have been trying without protection for a year, you've had sex at regular intervals and still you're not missing your period or conceiving, I think that's...
Yeah, that is what we define infertility as. Of course, if you're trying to get pregnant and you've had like very irregular periods, you're not able to perform sexual intercourse properly, or you're having severe pain or vaginismus, jisme again you're not able to do penetration, I think you need to come and see a doctor immediately. Last question. How do doctors treat infertility? Being an infertility specialist, Dr. Pooja.
I think, of course, giving hope is the first and foremost thing. Being positive about it. And with the latest technology, everything is possible. Anybody can become a mother and a father, I think, in today's...
So infertility is treatable. Just come on time. Don't shy away from it. And there are so many ways. It starts from simple. Sometimes we just ask you to do some lifestyle changes and you get pregnant. And sometimes you might need an IVF or something else. It depends on a case, but there are a lot of tools to treat infertility, like trying naturally, IUI, IVF, whatever. So that's how doctors treat infertility. I guess this was a fun session.
Yes.
And hopefully have a great day. Thank you.
Thank you.